We are more than a month into the stay-at-home order, but all this time cooped up, it can take a toll on your skin.
Yes, joining us now live via Skype with some skincare tips is board-certified dermatologist Dr. Peterson Pierre. Good to see you, doctor. Thank you for joining us.
Good to see you. Thanks for having me.
So let's talk about during this pandemic, you know, our skin can be affected, especially with many of us wearing masks out in public. Also, a lot of people at home staying in their PJs.
Eating all that junk food.
Eating all the junk food. Our skin is affected, right?
Absolutely.
How
what we're
are the
seeing
ways?
right now with all the stress going on, we're definitely noticing a lot more people with acne breakouts, definitely oily skin. The other thing that's happening too with all the stress is you can get some flare up of eczema. Your skin can get red, dry, itchy, irritated. And so these are things that are fairly simple to address during this time.
All right, so should you change up the skincare routine, whatever that is?
Yeah, I mean, I would say I like to tailor skincare routines to whatever it is that's going on at the time. So if you're currently experiencing any kind of acne breakouts, I'd go towards things like benzoyl peroxide, salicylic acid, retinol creams. Those are staples that can really help to get everything under control, can help with the oil production and things of that nature. If on the flip side, you're really rashy, red, irritated, then I would definitely focus on moisturizers, cortisone creams to really calm down that inflammation and get the skin looking and feeling better quickly.
I'm trying to remember with the mask, a lot of times there's a little perspiration because you're breathing a lot inside the mask, right? To wash your face or at least wipe it down, right?
Absolutely. Well, you got that heat there. You've got the friction of the mask rubbing up against your skin. So those typically are not good things. You have more sweating. So you can definitely either get more of that acne, more of that irritation. So being aware of that when you remove the mask, making sure you wash your face and things like that will definitely help to avoid any kind of problems.
Okay, let's talk about hand sanitizers in short supply. Is it safe or smart to make your own?
Well, I think in general, washing your hands is always going to be the better option. You can be more thorough. You've got something that is made by a company with standardized procedures. And so washing tops of the hands, backs of the hands, palms in between the fingers, underneath the fingernails, you can be pretty thorough. However, with all that hand washing, of course, your skin can get really dry and irritated. So I usually recommend alternating washing with hand sanitizers. If you can't find one that is commercially available, you can certainly make one at home. I usually recommend combining isopropyl alcohol that you can find anywhere, a little bit of either glycerol or aloe vera to tone down the irritation, tone down the dryness, keep it well moisturized, and use it as often as necessary.
Okay, what about our cell phones? They are so dirty. We put them down on things. We're putting them to our face. It's a mess.
Absolutely, it is a mess. I mean, there are a lot of studies that show the number and different type of bacteria that we have on our cell phones. So keeping those clean is definitely paramount, especially during this time. So I would recommend one of those devices like the phone soap that not only cleans the phone, but also uses the UV light to sterilize and disinfect it. Of course, during this time, they're in short supply. You can use the cleansing wipes that are specifically designed for electronics. There are also microfiber cleansing wipes that are also pretty effective.
Okay, a lot of folks not getting outside enough because of the stay-at-home order, so they're not getting enough vitamin D exposure. What happens to your skin if you become vitamin D deficient?
Well, there are a couple of things that you notice when you're vitamin D deficient. One, you have slower wound healing, and there's also a decrease in inflammatory production because vitamin D is a very good anti-inflammatory, so it can keep that down. Once you're deficient in vitamin D, now you're looking at your skin being more susceptible to irritation, to redness, to dryness, to flaking. If you get a scrape or a cut, that's going to be slower to heal. So the best way really to address that, obviously you can step outside in your backyard, go for a walk. That's not necessarily the most efficient way to make your vitamin D. You're probably better off just supplementing with vitamin D capsules Usually around, I recommend 5,000 international units. Take that every day of the week. Usually within a month, you can get your vitamin D up pretty quickly.
All right, Dr. Pierre, thank you so much for those tips. Very important. Appreciate it.
Thank you so much for having me.
All right, have a good one.
Thanks, you do the same.
All right, for more information on Dr. Pierre, you can find him on Facebook and Instagram or at pierreskincare.com. And of course, he's got great skin.
Yes, he does. That's a good thing.